Magandang araw po sa ating lahat. Ipagpapatuloy po natin ang ating pag-aaral sa types of Qi. Number 9 na po tayo. True Qi or Zhen Qi. Ito po yung last stage of transformation of Qi. Gathering Qi is transformed into true Qi under catalytic action of original Qi. Final stage in process of refinement and transformation of Qi. Qi that circulates and channels and nourishes organs. So, yan po yung ating diagram. So, from lungs, nagkaroon tayo ng air Qi, spleen, food Qi, then magiging gathering Qi, kasama po ng original Qi from kidney, magiging true Qi, at yung true Qi ay magkakaroon ng nutritive Qi na isi-circulate sa ating organs, at ang defensive Qi na sinicirculate ng ating lungs. Exteriorize, exterior. Also originates eventually from lungs, like gathering Qi, hence lungs function of controlling Qi in general. Two different forms, nutritive Qi or Zhen Qi and defensive Qi or Wei Qi. Originates from gathering Qi, Zong Qi. Originates from lungs, from the lungs. Assume the two forms, nutritive Qi or Zhen Qi and defensive Qi or the Wei Qi. Nutritive Qi or Zhen Qi nourishes internal organs and whole body. Closely related to blood and flows with it in blood vessels and channels. Siya na po yun yung from the food, naipon siya from the air. Tapos naging nutritive Qi na nagpo-flow, tumadaloy sa ating mga channels. Extracted from food and water. Regulate 5 yin organs, moisten 6 yang organs. Link with 5 yin organs, connect with 6 yang organs. Qi that is activated whenever a needle is inserted in an acupuncture points. So, yan po yung ginagawa pag ina-acupuncture natin yung mga points, yung Qi na yan ang isi-circulate sa ating katawan. Kung saan mayroong problema yung katawan, halimbawa nag-needle ka ng kidney, so yung Qi from the kidney, i-circulate niya para lumakas ang organ ng kidney. Nutritive Qi or yung Zhen Qi nourishes the internal organs. It closely linked to blood, flows in channels and blood vessels. Defensive Qi or Wei Qi, Wei, to defend, to protect, coarser form of Qi, as it flows on outer layers of body. Siya ito po yung dinidistribute ng lungs para kung may mga hangin, mga lamig, maproteksyonan yung ating katawan or init. It is young in the relation of nutritive Qi, which flows in inner layers and internal organs. Defensive Qi or Wei Qi, nutritive Qi flows in blood vessels and channels. Defensive Qi flows outside channels. So yung pagkakaiba po nun, pag nutritive Qi, yung from food, sa blood vessel po siya dumadaan. So, in form of blood yun. Pag defensive Qi ay outside channels. Derived from coarse part of food and water. Slippery in nature, hence cannot enter channels, therefore circulates under skin. So, sa skin lang po yung ating defensive Qi. Between muscles, vaporized in between membrane and diffuses over chest and abdomen. Nutritive Qi is the interior and nourishes. Defensive Qi is on the exterior and protects. Nutritive versus defensive Qi. Main function of defensive Qi is to protect body from attack of exterior pathogenic factors tulad po ng wind, cold, heat, or dampness. So, mula po yan sa climate. Ganun po yung ginagawa ng katawan natin, may defense mechanism tayo. Yung nutritive Qi warms, moisten, partially nourishes skin and muscles. adjusts opening and closing of pores. Therefore, regulates sweating and by so doing, regulate body temperature, warms muscle, fills up skin, enters space between skin and muscles, often pores. So, nutritive chi versus defensive chi. Being diffused under the skin, ito yung defensive chi po defensive chi comes under control of lungs. So, siya yung nag-distribute. Lung regulates circulation of defensive chi to skin and opening and closing of pores. Kaya kung mahina po yung baga natin, siya yung naka-open lang yung pores, yung pawis ka ng pawis, tuloy-tuloy yung pagpawis. So, madali rin pumasok yung mga pathogenic factors tulad ng hangin, init, lamig. Thus, weakness of lung chi may lead to weakness of defensive chi. This can make someone prone to frequent colds. Yung pag mahihina ang baga, mahina rin ang defensive chi. Okay po, thank you.
Thank you very much, Ma'am Mildred. Okay, so from foundations, pupunta tayo ngayon sa tongue diagnosis. And let's call on Ma'am Teresita Sumile to do the honors. Good afternoon, Ma'am Teresita. Okay, mukhang na-busy yata. Okay, so we will talk about purple tongue first. No? Purple tongue always indicates blood stasis. Okay, so every time you see a tongue that is purple, it always indicates blood stasis. So this may derive from cold or from heat. So meron tayong blood stasis deriving from cold, blood stasis deriving from heat. Internal cold contracts and obstructs the circulation of blood. So this will lead to blood stasis. Samantala. Okay, let's listen to Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome po sa tongue diagnosis. Now let's take up purple tongue. A purple tongue always indicates blood stasis, which itself may derive from cold or from heat. Internal cold contracts and obstructs the circulation of blood, leading to blood stasis. Heat leads to blood stasis by condensing the body fluids and blood. When blood stasis derives from cold, the tongue is bluish purple, while when it derives from heat, it is reddish purple. Therefore, the bluish purple tongue indicating cold derives from a pale tongue, whereas a reddish purple tongue derives from a red tongue. Okay? So this is a reddish purple tongue deriving from a red tongue. And this is a bluish purple tongue deriving from a pale tongue. Okay? This illustrates how bluish purple or reddish purple tongue develops. Cold manifests a pale tongue. Cold is obstructing the movement of blood, leading to blood stasis, manifesting a bluish purple tongue. Therefore, a bluish purple tongue derives from a pale tongue. Okay? And heat manifests a red tongue. Heat is condensing the blood, leading to blood stasis, manifesting a reddish purple tongue. Therefore, a reddish purple tongue derives from heat, red tongue. Okay? A tongue becomes purple only after a prolonged time, usually years. Therefore, it always indicates a chronic condition, and for this reason, it is far more common in the elderly. The purple color of the tongue indicates potentially serious conditions, and in the presence of such tongue body color, we should always invigorate blood and eliminate stasis. In addition to expelling internal cold in the case of blood stasis, deriving from cold and clearing heats in the case of blood stasis, deriving from heat, even in the absence of any symptom of blood stasis. Serious conditions relating to blood stasis in Chinese medicine include cancer, coronary heart disease, stroke, and hypertension. The tongue can be only partially purple, and the most common areas are the sides, liver or chest area of the tongue, the center, and the front third. The most frequent occurrence is on the sides in the liver area. Strangely, the tongue is never purple on the tip only, and blood stasis in the heart usually manifests in the chest or breast area instead. Okay? A purple color on the sides in the liver area indicates blood stasis in the liver, which may occur in any of the areas influenced by the liver channel. For example, liver blood stasis in the hypochondrium, epigastrium, lower abdomen, and uterus figure. It is interesting to note that although the uterus is in the lower burner, whose state is reflected in the back third of the tongue, blood stasis in the uterus is manifested with a purple color, not on the root of the tongue, but on the sides of the liver area. This is a purple tongue in. This is a picture of a tongue which has a purple color in the liver areas. As we can see in the tongue body, the whole size of the tongue is purple, indicating blood stasis in the liver areas. Okay? And this illustrates where the liver area is located. It is in the whole size of the tongue. Thank you so much for listening.
Thank you very much, Ma'am
So,
Teresita.
ma'am, may pasyente po ako noon na yung buong tongue niya purple. Pero ayaw po niyang magpagamot, ayaw rin magpa-doktor. Kasi ang paniniwala niya, nanunuraw po siya. Pero after 1 month po noon, namatay siya. Ibig sabihin po talaga grabe na yung stasis nung niya,
Yun nga.
nung katawan. Marami ng bara.
Kaya,
Congealed na po.
before kasi mag-purple yung tongue, ako I always look at the veins, the sublingual veins. Kasi pag medyo congested or dilated na po yung sublingual veins, early sign po yan. Kaya dapat ini-invigorate na po yung blood. Huwag na natin antayin mag-purple po yung tongue. Pag nag-purple na po yung tongue, that's a bit late na.
Yes po. Kaya nga lang po yung paniniwala ng pasyente na iyon, may nuno raw sa kanila yung po may mga punso. Kaya ayaw niya magpagamot dahil baka daw magalit yung nuno. May mga ganun paniniwala, pero yun po, namatay siya.
Okay, so sige po. From tongue diagnosis, diretso po tayo ngayon sa diagnosis by interrogation. And we are still feeling of cold, part 10. And this time, pag-uusapan natin yung alternating feeling of cold and feeling of heat. Alternating. Okay. This should not be confused with simultaneous feeling of cold and fever, which is characteristic of external wind invasions. There are two main differences. First, sa alternating feeling of cold and feeling of heat, the feeling of heat is a subjective feeling of the patient. Okay? In simultaneous aversion to cold and fever of external invasions, yung feeling of heat is an objective feeling. So you can feel that's a heat of the forehead and the hands of the patient on palpation. Second difference, in alternating feeling of cold and feeling of heat, the cold and hot sensations are alternating, whereas in aversion to cold and fever, they are simultaneous. Alternating feeling of cold and feeling of heat, it also occurs in external invasions, but only those affecting the lesser yang channels, triple burner, gallbladder, no? Whereas aversion to cold and fever occurs in external patterns affecting the greater yang channels. Okay, so the greater yang, this symptom is the greater yang is bladder and small intestine. This symptom is a chief symptom of the lesser yang pattern within the 6 stages or of the gallbladder heat pattern within the 4 levels. The latter is also a lesser yang type of pattern, but with the prevalence of heat rather than cold. This is reflected in the patient's sensations in that the feeling of heat is predominant over the feeling of cold. Okay, so to summarize, feeling of heat in alternating cold and hot feeling is subjective, whereas the feeling of heat or fever in simultaneous aversion to cold and fever is subjective. That is, the patient's body feels hot to the touch. Okay, now let's go to a little case history. An 18-year-old girl complained of an acute illness, manifesting with alternation of shivers and feeling of heat, swollen glands, sore throat, headache, lethargy, and a feeling of heaviness of the head. These symptoms began 3 weeks before the consultation. Tongue was red with red points in the front. So alam na natin yan with a thin yellow coating. So heat na heat. Her pulse was floating in general, especially on the front positions, and slightly slippery on the right side. This is a very clear case of acute invasion of wind damp heat, still at the exterior level, kasi doon lang po sa sides, no? Yung red points at the time of consultation. It is still at the exterior level because she still experiences shivers. Together with the typical symptoms of wind heat, there is also acute exterior dampness manifesting with swollen glands, a feeling of heaviness of the head, and the slippery quality on the right side of the pulse. Thank you very much. If you have questions, please ask them now. Okay, from diagnosis by interrogation, we will now proceed to pulse diagnosis. Let's listen to Ma'am Mildred again.
Pulse diagnosis, left rear position. Sa kidney po yun. Left rear position sa part ng kidney. Large intestine, kidney, then bladder and uterus. Yan po yung structure of left rear pulse position. Kung pinatong natin yung kamay natin, yan ang makakapa natin. Kidney. The left rear position reflects the state of kidneys, large intestine, bladder, and uterus. Letter A, yung floating. A floating quality with strength usually related to large intestine problem. So pag floating ay sa large intestine, para sa large intestine organs po yun. Whereas a floating quality without strength usually reflects kidney problem. So pag with strength sa large intestine, pag without strength, kidney problem. A floating, fine, wiry, and rapid quality on the left rear position indicates may stagnation po yung large intestine ng damp heat. A floating weak quality indicates weak kidney. Pag sa babae po, ang floating wiry quality nagsasabi na mayroon siyang blood heat in the uterus. A floating rapid quality on the left kidney position in a pregnant woman indicates the danger of miscarriage. So, pwede floating ang kanyang pulse. Pag deep naman, a deep quality here usually indicates kidney deficiency, especially kidney yang deficiency. it is an extremely common quality of kidney position, especially after age 40, and is more often seen in women. Two factors should be taken into account when judging whether this position is deep or not. First, it is normal for this position to be deeper than the front and middle ones. And second, it is normal for this position to be somewhat deeper in winter. A defined and weak quality of the left kidney position indicates a severe deficiency of kidney. So yung tandaan po natin ha, pag deep at weak, severe po yung karamdaman ng ating kidney. If in addition, kung ito pa is low, nagsasabi ng severe deficiency of kidney yang. If the pulse is deep, full and slippery on the distal side, nagsasabi po ito na may dampness ang ating large intestine. If it is deep, weak and slippery in the same position, it indicates weak large intestine Qi and diarrhea. So pag slippery naman, yung quality on the kidney position, ito po ay nagsasabi na may retention of dampness in the kidney and bladder. According to Dr. Shen, ang slippery pulse position in men may indicate the tendency to have frequent nocturnal emission. If the pulse is slippery, deep and full in the distal side, yung large intestine part po ito, nagsasabi na may dampness ang large intestine at possible pong nagtatay ito. So kung slippery, deep, and weak, it indicates weak large intestine Qi and possible din po siyang nagtatae. If the pulse is slippery on the proximal side, sa may part po ng uterus, nagsasabi na it indicates pregnancy if the heart pulse is strong and amenorrhea if the heart pulse is weak. So kung malakas, nagsasabi na buntis. Pero kung weak, may amenorrhea po siya. Thank you po.
Thank you very much, Ma'am Mildred. So we will now proceed to differential diagnosis. Let's have Ma'am Neets Yu. Good afternoon, Ma'am Neets.
Good afternoon, Doc Hector. How's my audio?
Medyo
Mahina?
mahina. Baka naano sa init.
Sobrang init, Doc.
Oo. Baka kailangan hindi headset, no?
Sige.
O yan.
Yan, Doc.
Yeah, very clear na po. Thank you.
Okay. Sige. So, ang topic po natin ngayon, Doc, please, share. Ang topic po natin ngayon in our TCM Foundations, number 184 is liver fire blazing. Okay. So, ang etiology, long-standing anger, resentment, frustration, excessive alcohol, sweet, fatty foods, and red meat. Okay. So, ang underlying or accompanying pathology, liver Qi stagnation transforming into liver fire, depressed internal damp heat. Ang sign and symptoms po nito ay outburst of anger, sobrang bumugso ang galit, irritability, inis, sudden onset tinnitus and or deafness, red face and eyes, bitter taste, temporal headache, thirst or pagkauhaw, dream disturbed sleep, dizziness, constipation with dry stools, dark yellow urine, nosebleeds, coughing of blood, vomiting blood, scorching hypochondrial pain. Yan po yung mga sign and symptoms. Ang pulse kapag tinignan nyo ay wiry and rapid. Ang tongue, makita mo ay red at yung size ay redder at mayroong dry yellow coating. Okay? So, kapag nagkaroon kayo ng ganitong patient, ang treatment principle, clear liver, drain the fire, and cool blood. Okay? Ang acupuncture treatment na gagamitin natin, acupuncture points, liver 2, clears liver fire. Gallbladder 34, courses liver qi. Liver 1, clears heat from the blood. Extra point taiyang, clears liver fire. Li1, subdues ascending liver qi. Gallbladder 8, benefits the head, alleviates the pain. GB34 or Du24 eliminates the wind, calms the shen. Liver 3 courses the liver. GB43 clears liver heat. Gallbladder 20 subdues ascending liver qi. Gallbladder 13 subdues ascending liver qi. Gallbladder 1 benefits the eyes, clears the heat. Gallbladder 6 clears the heat and alleviates the pain. Spleen 6, harmonized liver, calms the shen. Okay? Ang gagamitin technique pag needle ay reducing or with drainage. Okay? Thank you very much, everyone. I hope you learn. Thank you po.
Thank you very much, Ma'am Neats. Of course, we learned something, no, diba? Liver fire blazing. Okay, so next we go to angina pectoris, acupuncture patterns and practice. Let's listen to Ma'am Teresita. Ma'am Teresita, good afternoon po.
Good afternoon po, Dr. Hector and classmates. Patterns, practice. Now let's talk about angina pectoris. Key points of analysis. Quality of pain. The chief characteristic of an angina is suffocating pain in the chest. The quality of the pain may vary according to the relative degrees of deficiency and strength. The most common syndrome is pain with an oppressive quality, with more oppression than pain, and without fixed location. The chest pain is usually accompanied by rib pain and distension and by frequent sighing. This is mainly due to Qi impedance. If there is much sputum and salivary drool, pain that comes mostly during damp or overcast days, and tongue coating is greasy, it is mainly due to disturbance by turbid phlegm. If the chest pain is vague but suffocating, is precipitated by activity of is accompanied by shortness of breath and anxiety, it is mainly due to deficiency of heart qi. If the pain is stabbing or cutting and has a fixed location, it is accompanied by a tongue that is cyanotic and has PTK. It is mainly due to blood stasis. If the pain is colicky and is precipitated by cold, tends to be aggravated by exposure to cold temperatures and is accompanied by cold intolerance and cold limbs. It is due mainly to gelling of yin cold in the interior so that the heart vessels are obstructed by the gelled cold. If the pain is accompanied by symptoms of yang deficiency, it is mainly due to strong yin cold in the interior and occupying the place of yang. Deficiency versus strength. Angina is principally a condition of root deficiency, and appearance strength, that is, deficiency in the root cause, and the appearance is largely that of the symptoms of strength. Therefore, the first step in diagnosis is to ascertain what is deficient and what is strong, and what is root and what is appearance. In general, appearance strength is primary during an attack, while root deficiency is primary during remission. Appearance strength is mostly yin-cold gelling in the interior, turbid phlegm causing blockage, blood stasis with Qi impedance, or accumulated phlegm blocking Qi movement. Root deficiency is mostly deficiency of heart Qi, deficiency of both Qi and Yin, deficiency of heart and kidney, and spleen Yang. Deficiency of liver and kidney Yin, deficiency of heart and kidney Yin, or Qi deficiency with Yang collapse. Occasionally, root deficiency and appearance strength are equally prominent. This is mostly Qi deficiency with blood stasis, or Yang deficiency with turbid phlegm. Okay? Now let's go to severity of illness. The severity of angina can be assessed on the basis of several analyses. These include frequency of attack, the duration of each attack, the location of the pain, and whether it is fixed or not, whether the symptoms are primarily of deficiency or of strength, and the overall duration of the course of illness. The more frequent the attacks, the more severe is the illness. Short duration of an attack indicates a mild illness, and long duration, a severe illness. Duration of several hours, even several days, indicates the most serious illness. Pain with a fixed location indicates a more severe illness, and pain without a fixed location, a milder illness. Okay? If the main symptoms reflect strength, the illness is relatively mild. If they reflect deficiency, it is relatively severe. Recent onset indicates a relatively mild illness, but persistence indicates a relatively severe illness. In general, to assess the severity of the condition, it is essential to analyze the symptoms of the entire body as well as the local symptoms in order to arrive at an accurate diagnosis. Now let's go to acupuncture treatment. In the acupuncture treatment of angina pectoris, the main acupoints selected are bladder 15, bladder 14, CV14, CV17, PC6, part 5, and PC4. If the condition is due to obstruction of exogenous cold evil, it is appropriate to apply moxibustion to CV14 and CV17. Moxibustion may be applied to CV4 also. It is due to the accumulation of if it is due to the accumulation of turbid phlegm, add stomach 40, stomach 36, and spleen 6. Use piliform needles and apply the reducing method. Retain the needles for 20 minutes. Now we have case study number 1. The patient was a 55-year-old male. He had a history of hardening of the arteries and neurasthenia. His sleep was restless and he had vague chest pains. And at presentation, he had chest tightness with a feeling of suffocation, difficulty with breathing, and dizziness with headache. On examination, his tongue coating was white and his pulse is thread-like and slippery. Diagnosis: angina pectoris due to turbid phlegm causing blockage of chest yang. Okay. Case number 2. The patient was an 81-year-old male with a 15-year history of high blood pressure. For the past 8 years, he was also diagnosed to have coronary artery disease. He presented with suffocating chest tightness, as though a heavy stone is pressing on his precordium. He also had intermittent colicky, precordial pain, difficulty with breathing, and trance-like sleep at night from which he wakened with difficulty. His pulse was slow and irregular, with an overall rate of 30 beats per minute. His tongue coating was a dirty white and greasy. His blood pressure was 150/100 mmHg. Diagnosis: angina pectoris due to gelling of turbid yin, inactivating heart yang, obstructing the meridians and impeding the movement of qi and blood. Therapeutic principle: activate yang, eliminate the turbid, mobilize blood, and open orifices. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Okay, from acupuncture patterns, we will now proceed to signs and symptoms. Okay, this time we will take a look at the tongue. Topic is tongue ulcers. Okay, if you see tongue ulcers, the first consideration would be a full condition, heart, fire. So the tongue ulcers are painful with a raised red rim. Okay, the patient would complain of bitter taste, thirst, palpitations, mouth and tongue ulcers, mental restlessness, feeling agitated, insomnia, dream-disturbed sleep, feeling of heat. The face is red, tongue is red with redder tip and yellow coating. Pulse is overflowing and rapid. So acupuncture points, heart 8, LI4, LI11. Another consideration for tongue ulcers would be, so aside from heart fire, would be damp heat in the small intestine. So you will have tongue ulcers with a red rim and there will be dark urine. So this is very small intestine. Sticky yellow tongue coating, very damp heat. So overflowing, rapid pulse. Acupuncture points, small intestine 5, LI4, LI11, spleen 9. Okay, we will also consider, if we see tongue ulcers, combined condition, like empty and full. Heart yin deficiency with empty heat. So tongue ulcers will have a white rim, dry mouth and throat, palpitations, insomnia, dream-disturbed sleep, poor memory, anxiety, propensity to be startled, so madaling magulat, mental restlessness, uneasiness, feeling hot and bothered, thirst with a desire to sip fluids, okay, a feeling of heat in the evening, malar flush, night sweating, 5-palm heat, red tongue, redder on the tip, no coating because this is heart yin deficiency, no coat, floating, empty, and rapid pulse. So acupuncture points, heart 6. Incidentally, I think we all remember that heart 6 is very good for heart yin deficiency. Heart 8, spleen 6, Ren 4, Ren 14, and LI4. Other patterns, if you see tongue ulcers, full heat in the small intestine, Tongue ulcers will have a red rim, dry stools, dark urine, painful urination, blood in the urine, abdominal pain, dry yellow tongue coating, overflowing rapid pulse. Okay, heart 5 is the point to reach the tongue. Okay, so we use heart 5 as a point to reach the tongue, in addition to other points for the relevant pattern. So this is something that we should remember. Maraming salamat po. Okay, if there are no questions, we will now proceed
Hello,
to...
Doc. Yung ano po talaga, pag ang heart natin ay may heat, possible talaga ang small intestine ay magkaroon din dahil partner organ po siya nito. Tapos, dahil yung
Yeah.
small intestine ang taga-protect ng heart sa internal heat. Kaya kung umiinit po yung puso, i-absorb ng small intestine. Kaya possible talagang lagi siyang nahahawaan ng heat.
Very true. And you have to always look at yung urine, dark yung urine, yun.
Yes.
Some would say, ay, ano siguro to. Kaya pala yung iba, actually, hindi ko lang masabi-sabi. In fact, I had a nurse kasi siya na pina-check. Hindi niya, ano. So, sabi niya, ay, oo nga pala, naging tea-colored yung urine niya. So, parang it would look very, na medyo
Opo.
may kinalaman doon yung heart.
Ipapasa po ng small intestine sa urinary bladder yung heat. Kaya yung magda-dark din yung niya, ihi or minsan po blood eh. Iihi siya ng dugo.
Opo.
Mga connection.
So now you know. Maraming salamat po for the comment, no? So every time we see tongue ulcers, una-una nating i-consider is heart fire. And as acupuncturists, alam na natin anong gawin. Unahan na natin. Okay, so from tongue ulcers, punta na tayo ngayon sa a very, it's a very long topic but very interesting. And we will ask the kindness of Ma'am Mildred again to discuss the identification of patterns and treatment. Good afternoon po ulit.
Tuloy po natin ang asthma kasi uso ngayon dahil sa sobrang init, marami ring sinusumpong ng asthma. Identification of patterns and treatment. So during attacks, so hindi lang po pag mainit nag-a-attack ang asthma, ganun din na pag may wind cold. So pag may wind cold po, matindi yung kanilang pamamawis with sweating. So yung clinical manifestation nito, may slight sweating, asthma attack with breathlessness and wheezing. Less noisy than previous case. Not so much chilliness kasi nga cold eh. Kaya konti rin yung pawis niya. A feeling of tightness of the chest. Tapos kung titingnan natin yung face, pale po dahil nga wind cold yung umaatake. So kung hawakan natin yung pulse, tight po yan pero mabagal. So yung treatment principle natin, release the exterior, harmonize nutritive and defensive qi, restore the descending of lung qi, and calms the mind. So mga pwede po natin gamiting points, Ding Chuan, and bladder 12, bladder 13 sa baksyo ng lungs. Then 22, lung 6, stomach 36, spleen 6, heart 7, Ren 15. So ang gagamitin po natin ay reducing method except for stomach 36 and spleen 6, which should be needled with even method to harmonize nutritive and defensive qi. Pwede rin po siyang i-cupping sa bladder 12 kasi ito yung points na special points for the wind pag pumapasok sa ating likod. Kaya po di ba minsan yung pag nakabacklash yung mga babae, may madali pong sumakit yung likod kasi naka-expose itong bladder 12. So dun din dumadaan yung ating mga pathogenic factor tulad ng wind. So, Ding Chuan is stop acute asthma. Ang bladder 12 and 13 po ay nag-expel siya ng wind. Restore the diffusing and descending of lung qi. So pag pumasok sa katawan natin, pag tinusukan natin ang bladder 12 and 13, palabasin niya yung mga hangin. Pag Ren 22 naman po, restore the descending of lung qi and stop asthma. Pag lung 6, accumulation point, stop acute asthma. Stomach 36 and spleen 6, harmonize nutritive and defensive Qi. Heart 7, run 15, calm the mind kasi heart points, mga heart points sila eh. Heart 7 also restores the descending of Qi as heart Qi. Similar to Lung Qi, also had a descending movement. The descending of heart Qi will also help breathing. Run 15 also relieve fullness in the chest. So during attacks po, pag win-hit naman, makikita natin fever and aversion to cold. If through exterior invasion. Otherwise, feeling of heat, headache, tightness of chest, loud wheezing, barking, cough, asthma, slight thirst. Pag titingnan po natin ang kanyang tongue sa red side po towards the front, red. Ang pulse naman po ay rapid. Aversion to heat po siguro to, fever and aversion to cold. May fever siya pero ayaw din niya ng lamig. Yun. Yung treatment principle po dito, kailangan nating release the exterior, restore the descending of lung qi, expel wind heat kasi yung pumapasok sa katawan. Tapos calm asthma, calm the mind. So gamitin po natin ang lung 5, lung 7, lung 1, bladder 13, lung 6, and lung 11. Gamitin din po ang Ding Chuan, heart 7, run 15. So pag Ding Chuan at saka heart 7 po, 115, reducing method. Hindi po pwede mag-moxa dahil ito ay wind heat. So yung lung 5 po, clears the lungs heat. Water points din po yan pag ginamit natin. Ang lung 7, and lung 1 and bladder 13, restore the descending of lung qi. Pag lung 6 naman po, accumulation point, stop acute asthma. Lung 11, nagtatanggal din siya ng wind heat and eases the throat. Parang masakit yung lalamunan mo. Ding Chuan, stop acute asthma. Heart 7 and run 15, calm the mind and open the chest. So in between attack po, this refer to period of time when asthma attack are very infrequent or when the asthma is controlled by the occasional use of inhaler. So pag nag-inhaler, parang minsan stop siya. At this stage, some asthma attacks are typically elicited by exposure to cats, dogs, pollen, or dust, causing wheezing, breathlessness, and tightness of chest. If the patient is using inhalers, there is no conflict with Chinese herb or acupuncture. This can be used concurrently. So pwede lang pong kahit may mga iniinom siya, pwede natin acupuncture. Indeed, the frequency with which the patient need to use the inhaler can be a very useful benchmark to gauge the efficacy of the treatment. So acupuncture, the 4 aims of treatment with acupuncture ay una, to tonify the lung and kidney defensive qi system, to restore the descending of lung qi, to calm the mind. In late onset asthma, there is also the necessity to tonify the spleen. The points to use for the above aims are bladder 23, baksyo of kidney, tapos REN 4, kidney 13, bladder 52, REN 8, kidney 16, lung 9, do 12, bladder 13, lung 7, lung 5, REN 17, do 24, heart 7, do 19, REN 15, stomach 36, stomach 40, REN 12, bladder 20, and bladder 29. At 21. So mga pipiliin po natin to explanation. Ang bladder 23, REN 4, kidney 13, bladder 52, REN 8, pwede po nating imoxacones on salt. Ang ginagamit po natin to kidney 16, 9, do 12, bladder 13, ay itonify po natin. Tutonify lang ang kidney pag ginamit yan. So natutonify ang defensive qi system. Pag lang 7 po ang ginamit natin, 5, REN 17, bladder 13, ay nag-restore siya ng descending of lung qi. Pag do 19, REN 15 ay ikakalm ang mind. Stomach 36 at stomach 40, REN 12, bladder 20, bladder 21, Ito tonify po niya ang spleen, palalakas na ng spleen. Thank you po.